I'm Dr. Cheryl Iglesia. I'm a urogynecologist in Washington, D.C. I'm a professor in OBGYN and urology at Georgetown University School of Medicine and division director for the section of female pelvic medicine and reconstructive surgery at MedStar Washington Hospital Center. What do I want patients to know about sex? To me, as a urogynecologist, we deal with issues below the belt. Normally and routinely, we talk about bladder and bowel issues, problems with bladder and bowel control, pelvic organ prolapse. The other problem of sexual dysfunction is also very common among women. 43% of women have some form of sexual dysfunction, and although it's more prevalent as women age, it's less bothersome as women age. And midlife is probably the time in a woman's life when there's the most bothersome complaints. There are 4 domains of sexual dysfunction, and they include problems with desire, arousal, orgasm, and pain. Yeah, it's really hard because, you know, if you're talking about your bowel and bladder issues, that's one thing. Then when you talk about sex, you know, people have a lot of embarrassment about that. So I routinely ask my patients, do you have any issues about sex? And how does it bother you? And what kinds of things have you tried? If it's something that you have a problem with and you're embarrassed to talk about, I would suggest that you, at the end of the exam, after you've done your pap smear, or if it's needed, and breast exam, and you're dressed, you know, it's a time to say, you know, doctor or your nurse practitioner, I have a problem that I'd like to discuss, and it's something that really bothers me a lot. And it has to do with sex, and you know, they may blow it off, and because this is a routine exam, and then you should insist that you have another visit. And at that visit, all you do is talk about that, because I think that women are suffering needlessly, and many doctors may be embarrassed to broach the subject as well. But there are a lot of treatments that are very effective out there, and women need not suffer. I mean, you know, one of the most common as women age and are past the menopause is urogenital atrophy or vulvovaginal atrophy. We now call that the genital urinary syndrome of the menopause. And we can talk about lubricants, moisturizers, estrogens that are used either systemically or locally to help treat that. And you know, many women don't know about these formulations and what exists to help the condition. So, you know, it's a topic that, while sex, if it's good, can add, you know, some people say like a 20% value to a relationship. But when there's a problem with sex, the kinds of problems that can be in the relationship can be magnifold different, like 50 to 70% negative impact on a relationship compared to how good the positive aspects of sex are. So yes, it is something that deserves its own evaluation and management apart from all the routine stuff that you do on an annual exam, and women should take it seriously, and doctors should listen, healthcare practitioners should listen when a woman brings up the topic.